Now, the most commonest approach used for the implant placement is through the inframammary fold. There are also other approaches through the periareolar region, but that usually involves decrease in sensitivity of the nipple or damage to the lactiferous ducts. Then there is an approach through the endoscopic region, endoscopic approach via the axillary region, and through the umbilical approach, which is known as tuba. These cases you would need a saline implant or a foldable implant which can be folded in and then passed under the skin via the help of an endoscope. Obviously, it still depends on the patient and the surgeon preference, but the commonest one used is through the IMF, which gives a very precise approach to the breast tissue. So usually this length of the scar of the incision is of 3 to 5 centimeter, depending on the base width of the implant that is chosen. This incision is usually just below the IMF, because once the implant is in position, it is going to expand, it is going to lift the breast tissue. Therefore, this incision will move up to where the IMF lies. If you put the incision directly on the IMF, then the scar will land up on the breast tissue itself. So usually this is placed a little bit lower than the actual IMF, so that this becomes the future IMF. Now, this incision is also placed in a 1/3, 2/3 manner. That is, if you consider an arbitrary line across the nipple area, 1/3 of it is on the medial part and 2/3 lateral. This is to reduce the show of the incision as much as possible. As the maximal breast tissue will be in this region, it will be easily covering this scar. In certain cases, you may have to move the IMF position, so that makes it the future IMF or the new IMF. That further depends on the amount of breast tissue you have, the laxity, how much of lower pole fullness is required, and the type of the implant used. How is the new IMF created? For this, very strong stable sutures are taken, which are taken through the muscle fascia as well as the skin incision, and they are tightened in this region. This also helps prevent the downward displacement of the implant, which can lead to a double bubble deformity. Therefore, the IMF is one of the most important factors that you have to consider when placing the implant.